Well, actually, I went to medical school as a young student and graduated in 1973. And then I entered clinical medicine. I specialized in internal medicine and cardiology and practiced mostly acute and emergency care. And then after some 20-25 years of patient care and clinical research, I suddenly started to get interested in actually why do we run this business the way we actually do it. So what are the rules of the game? And so I gradually shifted more to management and governance issues, policy making issues, evidence-based or knowledge-based policy making, and finally changed my position to first local and regional authorities of Finland and then to the Ministry of Social Affairs and Health. Right now it is the health and social care reform that we as a country are trying to put forward. It is a very difficult issue, but everybody agrees that we have to go through it, even if it would take a couple of more years still. Then I think that from the professional point of view, I'm still quite interested in bringing professionals and administrators and policymakers to speak to each other, understand each other's language, and share a common knowledge base. It doesn't mean mixing their roles, but it means working for the common good together. And from the medical professional point of view, I think that we are facing the era of genomic medicine, personalized care, and that still appeals to me, and I would like to see what is going to come out of that. Well, I have to say that we worked so hard for it to prevent premature morbidity and mortality that we have to be actually very pleased that we have this elderly population that for the most of the time lives quite healthy lives. But we also have to face the challenges of the elderly population and take their questions seriously and work together with them to find answers to even the most difficult questions. There are many, but I think that they have this one feature in common, which is the will and ability to cross borders, step away from their comfort zones, work together with people who have different backgrounds and prefer teamwork instead of solo practices. Well, I start to belong to the target group myself, so I'm trying to live in a healthy way, do my best to prevent illnesses. But if something would happen, then my advice is to trust modern medicine, because it can help you a lot. And you can recover, and even with a chronic illness, you can lead a meaningful and happy life. And then you better live in peace with your family and friends and keep good relations. That gives you satisfaction, and one day you are going to be dependent on their help. And I hope that we will mutually help each other when those days come.